A very good day, everyone. I'm Dr. Nethravati, Professor of Neurology at the National Institute of Mental Health and Neurosciences at Bangalore. I head the Neuroinfections and Neuroimmunology subsection at NIMHANS. So today I'll be talking about my India Leadership Project, where I'm trying to develop a best practice model for leadership program for women. So if you see as to why I started this, basically, women actually represent nearly 60 to 70% of the healthcare workforce. But if you see at the senior level or the leadership role, there is few or very less representation. This is because of the gender gaps, discrimination, which persists even in the healthcare system. So my aim was to see whether what are the gaps, and then whether we can come up with some best practice model for a woman to help in a leadership program. So how did I start this? First I actually started a Google survey questionnaire, but initially it was non-anonymous. Then I had to take the ethics committee approval, and that has been taking time. Then took a non-anonymous data. And because the ethics committee approval has not come up, the next stage was to have the story banks and leadership messages, and then finally come up with some leadership model. The last phase has not yet been done because of the ethics committee approval not being received from the institute. So there were 72 women. Most of them were between 30 to 45 years of age, and many had good work interactions among colleagues, and few of them definitely reported a lot of harassment or bullying. So when we look at the challenges what a lady faced at the workplace, there were many. And because of the workplace environment, very few were there, like gender bias, patriarchal attitude, being judged, being a woman, and very less support from the colleagues. But more than this, the biggest challenge was from herself, because she's always multitasking, trying to balance between the work and the family. There was a lot of stress. Many felt that actually they're feeling like as if they're having a pressure cooker feeling, 24/7 responsibilities, because of which poor physical and mental health, and many of them were also depressed. And because of this, naturally taking up any role, forget it, was difficult. And we were asking about the leadership roles to these patients, to these women. So when I asked them what are the strategies which make them help, few of them told that I do not know what I need to do. I'm not properly guided by my seniors. I do not know whether I can voice my opinions sometimes. So these were few things which they felt required some clarity. Apart from that, when we are trying to balance our family, if there is something like a childcare facility or some support for a senior citizen, it is more easier for me to work at the workplace. As well as many of the times, because I have this stress and because of multitasking, would help if there was a counseling or a peer group support. And these team building exercises, which is very highly prevalent in non-healthcare industry, is just not heard of in healthcare industry. And this needs to definitely come up here. And I also need to strengthen myself and become a better person. And that is by socialization, meditation. And some also felt that they require a menstrual leave, and many felt they were not independent financially. More than that, it is the women always who creates problem to other women, and hence the women should empower and support other women. Going way forward, I have a good team which I have built over the years academically, trying to head two specialities. And I feel this India leadership has made me realize that it is not enough just building a team. It is important to take care of them also, as well as I take care of myself in the future. And that is the biggest lesson I've learned from this India leadership journey, which I try to implicate. And going forward at the institute, I definitely want to bring about some empowerment strategies, some empowerment programs, courses for people. And once the ethics committee approval is brought about, bring about these story banks either in the form of blogs or publication, and eventually also form a big peer group support. And I would like to thank the India leadership, basically making me realize that I learned mainly two things from this. One was that it was not enough just to have a team, but to take care of them. The other thing was all of us have negatives and positives, but to build upon your positives and to curb your negative was the biggest thing to do, so that it amplifies my strength. Thank you.